Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning, Ina.
Good morning, Dr. Mencia. How are you?
I'm doing good. Missing my lovely Anita, but we are here, you and I.
Yep.
So we're gonna roll it.
Oh, that's how we do it.
This is how we roll. Welcome to the show, Ina.
Thank you.
I thought today I saw a few patients that came in with something that used to be called Syndrome X. You know what they call it, Syndrome X? Because we didn't have a diagnosis for it. So X like an unknown factor, like in algebra.
Right.
The unknown factor.
When we don't know something.
We don't know. We say, we're just getting. And then we are basically baby boomers that will come in with a heart attack or a stroke, or baby boomer being diagnosed with diabetes. So, there's a group that started putting this patient together, looking for common denominators on them. And the initial name that they gave back in the day was Syndrome X. And then eventually they found out it was a metabolic problem. It was a problem with metabolism. And now we call it metabolic syndrome instead of Syndrome X. So for our Pencil Talk audience, you might want to look it up under metabolic syndrome or Syndrome X. But the most recent name, the more actualization you're going to find under metabolic syndrome. And you can Google the name, and there's a lot of information out there on the internet on metabolic syndrome. So what is a metabolic syndrome, right? So a metabolic syndrome basically is a person that has, number one, you have to have an elevated blood pressure, an increase in your blood pressure. And the blood pressure, the bottom number, usually will be above 85 or 90. And the top number, the systolic, above 130. So it could be mild elevation of blood pressure or significant elevation. Anything above those numbers, it could go from mild. If it goes really high, then it could be severe elevation of your blood pressure. And, keep in mind, as we're talking about blood pressure, that blood pressure is considered a silent killer. So a person's blood pressure can be rising without giving you absolutely no symptoms that the blood pressure is going up. Until it gets to a point that it affects one of the organs. For example, if it affects the brain, it might give you a TIA or a full-blown stroke. And if it affects the heart, it might give you a heart attack. But one of the parameters that we use to diagnose a person with Syndrome X is increased blood pressure.
So it's very important to keep your blood pressure under control.
Keep it under control and get a check. If you are a young baby boomer, get a check at least once a year. Now, we can just spend the whole show talking about blood pressure because it's such a wide topic. But it's important for people to know when you go to a pharmacy and check your blood pressure, that might not be as accurate as going to your doctor's office. And then when you go to the doctor's office, I see a lot of offices that they don't use the standard blood pressure machine, which is what you and I have at the office. That's the standard. Meaning that if we're going to do research on anything that had to do with monitoring a person's blood pressure, we have to have the equipment that we have at AGI. So we have to have this kind of equipment. There's a lot of portable equipment. And you talk to anybody that had been monitoring their blood pressure with portable equipment, they will tell you they have 3 or 4 because they buy it, they think it's working, then they go to the doctor.
It's not that accurate.
They are not that accurate, right? And the best thing, if you buy a blood pressure machine, when you go to your doctor, have your doctor, if they have the right equipment, that is, have your doctor or the nurse, before the doctor walks in or after the doctor walks out, have the nurse check your blood pressure with your machine and then with the standard. And then you can see what is the difference between those two. If they are very close together, that means you have a good machine. If they are way off, especially with the pulse, because those machines give you your pulse and your blood pressure, then you don't have a good machine.
Right.
Okay. So the first one was the elevated blood pressure. The second one is what we call high blood sugar levels. Now, some people say, well, I'm not a diabetic. I'm just borderline. I have a little touch of diabetes. Regardless, if you have the high blood pressure and you have any of the above with regard to sugar, that's what we call a person that is insulin resistant. That means that the insulin is not able to process the sugar. Now, you might ask, well, how did this happen if I didn't have that when I was younger? Well, when you were younger, you have a young pancreas and you had a young liver, and you would take a whole pizza. And if you were a teenager or a young adult, we have a whole pizza and a six-pack. And you check your blood, and the sugar looks good, the liver looks good, nothing happened to you. As we advance in age, then the pancreas is not able to handle that much carbohydrate. And that's when we start suffering, and that's what we call insulin resistant. The third indication that you have a metabolic syndrome, if you have excess amount of fat around your waist.
Why is that so important around the waist?
Well, we have two type of obesity. We have what we call peripheral obesity. Those are people that have big arms. They will have a big belly too. Big leg, big arm, big neck, everything is big. We call that peripheral obesity. Central obesity is when they have a skinny leg and skinny arms.
And they have a belly.
They have a big central, the belly is big, everything is small. It's called central obesity. So, if a person look at their waist and they see that their waist getting into the baby boomer age, and that waist is getting bigger, you are increasing your risk. Because these are all things that we can still control. Once you let all of them pile up, then it becomes metabolic syndrome. So that's the third one. The fourth one is when you get your blood test done, the patient usually asks me, what's my total? They want to know what the total cholesterol is. And sometimes your total cholesterol can be within, it can be good within range, but that is not what's important.
Important what is good and what is bad.
Exactly. You want the breakdown. What is the breakdown? What is my bad cholesterol and what is my good cholesterol? Now, we have to be careful because usually the LDL cholesterol is what we call the bad cholesterol. Triglyceride, we usually do not call bad cholesterol. But when it comes to metabolic syndrome, these are people that have high level of triglycerides. And then the last parameter that we look at to be included in the metabolic syndrome is that your good cholesterol, your HDL, is low. So the way I usually explain it to the patient is like HDL are the caps.
It's not many of them, right?
Yeah, exactly. If you don't have many caps in the community and you have a lot of
bad guys,
they're going to have a tendency to break into your house and steal into your car and, rip you off and do all kind of things because you have a lot of bad guys in the community. So we need to get more caps in there. And the way we get more caps in there, in the community, we increase the HDL. We increase the good cholesterol. The HDL is what we call the protective one. The protective cholesterol.
And how, Dr. Mencia, you can increase your good cholesterol?
Well, the good cholesterol, you have supplement of omega-3 fish oil that you can use. And we've done a lot of research with, we have 3 dietitians in at the AGI. So in the research that we have done, we have put together supplement that will help you increase your good cholesterol. And also with your diet. There are people that they don't want to take supplement. They just want to work with their diet, and that's fine. So if you eat olives and sardine and salmon, it's flaxseed, it's a lot of things there that can help you increase your good cholesterol.
So, Dr. Mencia, the patients, from what I understand, everybody who diagnosed with metabolic syndrome, they're good candidates to be seen by dietitians.
It's extremely important. And all of my patients, when they start piling those 5 things we just went over, I tell them, go and see the dietitian. And a lot of times they go and they just do one consultation and walk away. And I say, well, you need to use the dietitian as your coach. First of all, it's covered by your insurance. So if you go and see a dietitian outside a doctor's office, usually the person will have to pay because the dietitian don't have the license to be or the insurance.
Right.
So you have to pay the dietitian for that person to become your coach. And you're going to go as often as money you have. If you don't have enough money, of course, you're not going to go too often. If you have plenty of money, you're going to go often and see your dietitian.
Correct.
And that's why you have all those weight loss program. And, they all have either nutritionist or dietitian to work there and be your coach and coach you and call you on the phone or send you text. And we do all of those things, but we do it under the insurance. It's covered by all insurances. There's no insurance that will decline a dietitian.
Right.
Because it's more cost effective. It's cheaper for them because, insurance don't want to pay on prescription if we don't have to. And there are many of us that don't like to take medication. And I'm one of them. If I can fix something with my diet and activity, why take a pill? I don't want to take a pill.
So diet is a key to everything. Healthy lifestyle.
A healthy lifestyle is extremely important to not to become a walking pharmacy.
There you go. Yes. Dr. Mencia, who usually will diagnose patient with
metabolic
syndrome? Is it the internal medicine doctor or dietitian or?
All of the above, yeah. The internist, the family practitioner, the cardiologist, the neurologist, sometimes when it's too late, will diagnose you with metabolic syndrome. But, we can diagnose ourselves at home.
That's interesting.
You just have to remember the 5 things we just mentioned and check yourself out every so often. Check your waist size, check your blood pressure. When you get your blood test, get a copy of your blood test and track down your triglyceride and track down your good cholesterol. Because if, a lot of my patients, they are very involved with their health, and they track their good cholesterol, the triglyceride, and they have it in their computer. They have their record where they can print it out at any time and show it to anybody. Especially if you have to go and see a cardiologist just for a routine checkup. So among the risk factors that you have, there are 2 central risk factors. Central obesity, as we just described, so a person that is skinny in the extremity, but big in their trunk, in the waist, especially the waist side. So central obesity. And number 2, the insulin resistant.
Right.
I mean that they have difficulty the body have difficulty handling sugar. So remember, as we age, as we hit the baby boomer age, then it becomes more and more difficult for us to handle sugar. And hence, we have to cut down on sugar. I don't like the word sugar because sometimes we forget about other things that can increase. Yes. We know about sweet being sugar, but we forget about the carbohydrates becoming, sugar and vice versa. Sugar becoming carbohydrate. And when carbohydrates go high, that's when triglycerides tend to rise.
That's when we eat a lot of pizza.
Exactly. So if you eat a lot of pizza,
bread,
pasta,
spaghetti,
bread,
potatoes,
rice, potato, all of those are carbohydrates. And a lot of my patients, they know what we call the Mencia's diet. So when I see a patient with triglyceride going up or the sugar going up. And I tell them, I say, look, follow the Mencia diet. It's very simple. You don't have to count calories. Recognize what the carbohydrates are, recognize them, and cut down by half. So you look at let's say, if you eat half a plate of rice, make it a quarter. If you eat a loaf of bread, make it half. If you eat 4 slices of bread, make it 2. If you eat 2 scoops of ice cream, make it 1. So you don't have to, I tell people, I hate to have people change their lifestyle. And food is related to culture. So if my patient is a Chinese person or an Indian or Afro-American or Caucasian American, Hispanic or Russian, they all have their diet. They all have according to the ethnicity, the food.
The demographic area where they live.
So I don't change people's life. I don't say, now you won't eat no more Indian food. Now you're going to follow the American Diabetic Association. No, that's crazy.
Right.
I believe that the first step, especially with something like this that can be easily fixed, the first step is to go ahead and cut down on the carbohydrates by 50%.
Dr. Mencia, let's say if I will cut my amount of potato, I eat half. And after I finish my dinner plate, I still feel kind of not satisfied, full. What would you suggest? Like if somebody cut their plate by half, but they still feel
not
satisfied
right
at the end.
And that makes sense. That's one of the main reasons we fall off the wagon when it comes to diet. You need to substitute then. You need to substitute with vegetable.
So we need to eat more vegetables or more
vegetables
fish.
And more fish, more lean meat, chicken, turkey, fish. Eat more lean meat to satisfy yourself. And vegetable, eat more vegetable. It's going to help you have better bowel movement. It's going to give you satiety, that you feel full now with your food. And sometimes having a small portion of vegetable. If you are a true diabetic, so we talk about the carbohydrate, and everybody know about the sweet. So we won't talk about sweet. We know sweet. Well, we will talk a little bit about sweet, but let's talk about no, because the one thing I want to say about sweet, so we just put it aside. If you want to control your diet, the worst time to eat sweet
after 6 o'clock
dinner.
Or
yes,
after dinner.
After dinner. That's the worst time. Because then you're going to sit down, most likely watch TV.
Lay down,
you're going to
fall
lay
asleep.
down, go to sleep, and you're going to absorb 100%
of all that sugar.
Of all that sugar. Whereas if you're going to have sweet and you say, I'm going to have it at lunchtime. Well, you know what we do at the office.
Right.
Right after lunch, we go back to work.
To
we are moving,
work, yes.
And we're gonna metabolize. We're gonna burn all that calories. So if we have to have sweet, if you feel like having sweet, try to have it during lunchtime and not during dinner time. Try to have it around lunchtime.
Right.
And some people say, well, if I eat early at 4 o'clock, then I can have my sweet. Yes, if you're gonna go walking and do things. But if you compare the amount of activity you do
throughout
your
the day,
evening compared to throughout the day, most of us do a lot more throughout the day than in the evening. So don't fool yourself and try to move the sweet down to lunchtime, no after dinner. So that was the sweet, the carbohydrate. The other one is the fruits, because that's natural sugar. Right.
Not all the fruits are healthy, right? A lot of them has a lot of sugar in them.
A lot of them can have a lot of sugar. And, usually we talk about having fruits because of the fiber we're going to get and the benefit, the blueberry, the cranberry, or
and mostly like berries, if we have berries, not like a watermelon or something, which is loaded with sugar.
Right. And if you need potassium, the kiwi, the banana. So fruits are important in our diet. But if you have insulin resistance, if you have problem handling sugar, you cannot eat a pound of cranberry
Excessive
or
amount.
blueberry. You have to eat a cupful, a handful, and that's going to give you enough of the nutrients that you need for a day. So cut down on the amount of fruit you eat. If you are a full-blown diabetic, you definitely want to cut down on your fruit by 50% or so, like we did with the carbohydrate, and concentrate on more vegetable and more lean meat when you eat, and eat, several portions. So those are the two main risk factors that you ask about, who is at risk of developing the metabolic syndrome. Central obesity and people that have resistance to insulin. But there are others also that have been looked at and included. One is age, as we say. When we were younger, in our teen, we could eat a whole pizza, a 6-pack of beer, and we would go on about our business, and everything was happy-go-lucky. As we age, we do that, and we feel already like 3 or 4 pounds because we cannot metabolize.
Heavier, right.
Right, we cannot metabolize that fast. So age is another factor. The other one is family history. So if you have family history of central obesity, of diabetes, then you have to look into this syndrome, and the earlier you start looking into this syndrome, then the more preventive you are being, because this is preventable.
Right. So it is very important for people to do their annual wellness exams.
Right, and to check yourself, see your diet, see what kind of diet you follow. And sometimes we think because I eat so healthy and because I'm so active, I don't have to check myself.
Yes, you do.
That is not true. You have to get yourself checked. Because remember, when you check your blood pressure at home, you measure yourself, you look at yourself, you accept. You get to a point that you accept it. But the physician, the doctor, the nurses, they are more objective. And sometimes I just, we have the electronic medical record. So sometimes I just show the patient, I say, look at your weight 2 years ago. Look at last year. Look at now. Look at your BMI, how it's moving up. And as your weight increase, look at your blood pressure. And you can see it in black and white in front of you. But, at home, I'm not going to be that objective.
No, because at home you see yourself every day and you're used to yourself to see yourself. But when somebody sees you once a year, they see a big difference.
Right. So the other one is sedentary life, people that are not getting enough exercise. And there are many ways of exercise. Some people think, oh, my God, because I have knee problem or have a hip problem, I don't walk anymore. Well, you can do a recline bicycle, you can do swimming. There are many things you can do that is a form of exercise. You can do upper extremity if your lower extremity are not active.
How about yoga, Dr. Mencia?
Yoga and Tai Chi, they are a form of exercise, they are activity. And there's nothing wrong with starting with something mild and easy to follow. Okay? And then increase as you go, as you feel ready. You have to, I always say, you have to listen to your body. Your body tell you when you're going to be ready. And then women with polycystic ovarian syndrome, they are at risk of metabolic syndrome also. So basically, the way we make the diagnosis of metabolic syndrome is look at the waist, and we check the circumference around the waist. The fasting blood triglyceride, we need that. The good cholesterol level, we need that. Your blood pressure and your fasting sugar, your fasting glucose level in the morning. And with those things, we have enough information to make the diagnosis of metabolic syndrome. And you might say, well, if it's preventable, it's easy, why should I worry? There are pills we can take, but we don't have to. We can just change our lifestyle. Why is it important? Because those individuals that belong to this group, that have this constellation of these characteristics, right? They are at risk of cardiovascular disease. They can have a heart attack. They are at risk of peripheral arterial disease. They can develop fatty liver. So sometimes when we do ultrasound at the office, and we look at the liver on the patient, we see fat accumulation.
Oh, wow.
And that's one of the consequences. They can develop a stroke. They can have a TIA or a full-blown stroke. They can develop kidney disease, heart attack, diabetes, hardening of the arteries, what we call arteriosclerosis, heart disease. They can have damage of their eyes, what we call retinopathy. They can have damage of their nerve, neuropathy.
Because it all comes from sugar.
Exactly. So it's like almost like a full-blown diabetic.
Right.
So, some people say, but I am not a full-blown diabetic. Why do I have the neuropathy? The sugar is high enough to produce damage in your nerve ending by your feet and your hand. And they can even have amputation of the extremities as a complication of metabolic syndrome, which is the same complication that we see with a full-blown diabetic.
Correct.
And it can, it's so easy to treat, basically, exercise and diet modification. There are people that talk about using medication like to lower the triglyceride and to lower everything. But my advice to our audience is do it without medication. Change your diet. See the dietitian. And we're going to break it here, and then we'll be back with our guest for the next half hour.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.